Karan, you mentioned palliative care. I was wondering if you could talk a little bit more about what is palliative care broadly, and also what if a patient's being seen in a place where there isn't a palliative care service? What kinds of resources might be available for those patients?
Yeah, and I think that's a really important question. So, in the most typical sense, or what we hear often, me being palliative care trained, there is a certain level of stress or stigma associated with palliative care. But by palliative care, what we essentially mean is someone, a trained, qualified physician who has gotten training in treating complex issues in chronic illnesses. And these complex issues could be psychosocial, could be religious, could be symptom related. And by symptom related, I mean is, whether it's nausea, diarrhea, pain. It could be a breadth of all these symptoms included. Typically, in the oncology field or in the cancer field, when we bring on palliative care physicians, we bring in or we seek their help when we need more hands on deck to help us with their symptom management. It could also be palliative care physicians can also help us with end of life discussions if a patient is approaching that scenario, but it is not always the case. So, this is where palliative care physicians are really helpful because their sole focus is to improve the quality of life of the patient. And I think that's the biggest sort of factor that the patients also look forward to when they are talking to their palliative care providers. Now, again, depending on each institution, some institutions would have palliative care physicians on board or in the institution itself, but there are times where in the community itself, you can have palliative care physicians. And I think, Meera, you mentioned about a great resource, and I would love for you to share it with them, with our patients on how to find palliative care.
Yeah, for patients who, there may not be palliative care service at their institution or the cancer center where they're being seen. There are some resources to help find palliative care. You can ask your oncologist for referrals to other institutions close by that may have a palliative care service. We also want to highlight this website, getpalliativecare.org, where patients or oncologists or providers can search geographically for where there may be local palliative care services as well.